Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Thank you to Mr. Nobel Mawunga on the Sign Language Desk. As of Thursday, 10 December 2020, Zimbabwe had recorded over 11,000 confirmed COVID-19 cases, over 9,100 recoveries, 304 deaths, and a case fatality rate of 2.7%. Local, or what we call community transmission, continues to be the main source of infection. Note, however, that in the past 7 days, the country recorded 42 imported new cases. 37 or 88% of these were from South Africa. The complacency we are seeing in our communities is a big concern. It is contributing to the increase in new cases and is therefore threatening to derail the national response. People are simply not wearing their face masks anymore. Let me once again remind the nation that as long as no vaccine has been rolled out, the only solution to this pandemic here in Zimbabwe and elsewhere is strict adherence to the existing recommended preventative measures. They work. We all need to wear a face mask, social distance, stay away from big gatherings, as I have said before, and of course frequently wash our hands with soap and running water. Sanitize them with an alcohol-based sanitizer. This is our new normal. Let us take it seriously. Most of our communities seem to be surprised by the increase in cases that the country is recording. This increase is, however, really something that we had expected in view of the high local transmission and, of course, the complacency that we are observing in our communities that I keep talking about. To address this surge, government is strengthening its national response activities, guided by the findings and recommendations from the recent National Interaction Review that I shared in early updates. Specifically, government is focusing on strengthening risk communication, including immediate development of appropriate new messages to address COVID-19 complacency within the communities. It is also strengthening enforcement of COVID-19 regulations, as well as strengthening event-based surveillance through decentralization of call centers, for example. Government is also sustaining social safety nets to protect the vulnerable, especially in view of the ongoing transmission. While the above activities and many of the other interaction review recommendations are being implemented, government continues to also prepare for the rollout of the vaccine. The country, through the National Immunization Committee and the Interagency Task Force Group on Immunization, has made good progress in preparing for a vaccine rollout, as mentioned in my previous updates. These vaccine rollout preparations should, however, not distract us from focusing on the existing recommended preventative measures. It is also important to note that Zimbabwe has not yet approved or endorsed any vaccine. The country will only approve and roll out a vaccine that has been analyzed and found to be effective and safe. In the meantime, once again, the existing preventative measures are our solution. Let us adhere to them. Last week, I talked about the reopening of borders on the 1st of December 2020 as outlined in SI 282. Following this reopening, we sent out teams, we deployed teams to monitor the situation and to provide support and supervision. Preliminary reports from these visits indicate that there are no major congestion issues at the points of entry as was initially anticipated. The main challenges, however, that we observed include complacency once again by communities at these ports of entry, as well as reports of suspected fake COVID-19 free certificates. This issue is currently being investigated, and I will, of course, update you in my next reports once we have the findings and plan in terms what we need to do. Last week, I also talked about COVID-19 outbreak investigations in a number of schools where the majority of identified cases were asymptomatic. They didn't have any symptoms or signs. Reports from monitoring, support, and supervision visits indicate that the situation in our schools is now under control. Government is grateful to parents in the affected schools for not only being cooperative during the outbreak, but for also remaining very calm and very supportive during the investigations and the implementation of the recommendations. Government would also like to thank the teachers and other school authorities who stepped up to ensure that the situation was brought under control in a very timely fashion under the guidance from the Ministry of Health and Childcare and from the Ministry of Primary and Secondary Education. Lessons learned from these outbreak investigations are being used to strengthen management of other learning institutions with a focus on ensuring that the school environment remains safe for both the learners and the teachers. As we prepare for the festive season, let me continue to remind each other to do the right thing. Wear your face mask, avoid big gatherings. In fact, do not organize big gatherings if you can. Social distance and stay at home if you do not have any pressing essential business out there. Your life depends on it. So do, of course, tune into ZBC, the radio, and other media platforms for this weekly update.